Complications can arise in pregnancy, but most are preventable. Hi, I'm Kediesha Watkis, and this is the Wellness Beat. On today's episode, I am talking with a public health specialist, award-winning public health specialist, Dr. Carol Lord. She is Program Development Officer inside of the Ministry of Health and Wellness, with a groundbreaking research doc for which you have been awarded.
Yes.
And it is quite interesting what you have found, and our discussion today on antenatal care, maternal care, will give us more insight into that. So the Ministry of Health and Wellness is urging women to get into antenatal care as soon as there's a missed period. That's what you were sharing with me.
Yes, yes. Actually, thank you for having me here. And women's health is very important. We need them to get into care before they get pregnant, where they can receive preconception counseling.
Yeah, we were talking about that. You were telling me, and I was like, what is that?
Yes.
Tell us about preconception
preconception counseling is that we want you to have the right body, be healthy before you go into pregnancy. Because our research has shown that women who have high blood pressure after 20 weeks of pregnancy have severe complications, not only to the mother, but also to the baby. And that makes a big difference.
And so what you have found, Dr. Lord, in your own study is that we are perhaps predisposed to some conditions which can then impact the health of both the mother and child in pregnancy.
Yes, actually, the research we did looked at the high blood pressure in pregnancy, in women in pregnancy. We did it in the Southeast region, looking at really between the periods of 2015 to 2019. And we were looking at the 5 hospitals. That includes the University Hospital of the West Indies, Victoria Jubilee Hospital, Spanish Town Hospital, Princess Margaret Hospital, Instead Hospital. And these hospitals, we look at the persons who had high blood pressure in pregnancy. And what we found was very alarming. We found that we looked at the records of 788 mothers that were at these hospitals during that period. And it was really looking at a retrospective study, looking at what happened to these mothers and these babies. And so what we found is that mothers with preeclampsia and eclampsia, actually their outcomes were suboptimal, were less than those who did not have high blood pressure. What do I mean when I say preeclampsia and eclampsia?
Yes.
So preeclampsia is really the high blood pressure of over 140 and 90, greater than 140, 90, after 20 weeks of pregnancy. And this is actually associated with swelling of the hands and feet, and it can also be associated with protein in the urine. Eclampsia is life-threatening on the other hand, which is a severe preeclampsia where they can have jerky movements of the hands and feet, in that they will have seizures. And just imagine a young, healthy, pregnant woman with seizures, whereby they can just lose their awareness of everything. In fact, part of the study showed that some of these women said that they just were not feeling well, and then when they do caught themselves, is that they woke up with doctors and nurses around them in the hospital. Just imagine that.
Right. And so then, if we have not gone into care before pregnancy, it means that by the time there is labor and delivery, there may be some very, very adverse outcomes. What have you found with that?
All right. The adverse outcomes we found is very sad, because we believe in every baby having a good start and every mother having a safe pregnancy. So when women would have experienced the preeclampsia and eclampsia in pregnancy, what happens is the babies, let's focus a little on the babies. The babies, they're born with low birth weight. That has its own complication. They can born too soon, in that the prematurity, in fact, the prematurity is about 51 per every 1,000 births in persons with preeclampsia. We found they were premature babies, and premature babies need intensive care depending on the level of prematurity when they are born. And so this is very important. The important thing is that for the mothers, if they have preeclampsia, in addition to the prematurity, in addition to the having low birth weight, they can have what we call low Apgars, whereby the babies they're 8 times more likely to have low Apgars score, whereby the babies, the blood pressure and the blood flow and the blood oxygen to these babies are low when they're born, meaning they're born very weak, and they have to take them to the nursery where they will require neonatal intensive care. And so that is very important, because we want to give baby a good start.
We want to give them a fighting chance.
But in addition to that, these mothers, if they experience eclampsia and preeclampsia, can actually have babies who did not survive before they were born. Imagine carrying a pregnancy for 9 months, and at the end of that pregnancy, there isn't a live baby.
Devastating.
Yes, and what we found is that 71 out of every 1,000 pregnancy that have preeclampsia, eclampsia had stillborn babies, compared to just 7 who had normal blood pressure. That's big.
So we're talking about some serious business here, Dr.
Yes.
Lord, when it comes to our maternal care. I want you to walk me through what exactly takes place during these antenatal visits. Because if we're urging women to come in, let's take a picture and a look at what happens during those visits.
Okay, so I realize that I am pregnant. I go to the health facility. Here's where you are booked at the antenatal clinic. When you're booked at the antenatal clinic, you're given certain investigations that are to be done. After the investigations are done, you take the results back. When they review and analyze these results, they will say whether you have a normal pregnancy or whether you have a high-risk pregnancy. And so risk is very important in having favorable outcomes in pregnancy for mommy and the baby. For example, in our study, we wanted to find out, well, listen, what were some of the risk factors that persons could know, well, listen, you end up with eclampsia or preeclampsia. And so we found that this is your first pregnancy. Some person with the first pregnancy can have eclampsia and preeclampsia. If you're less than 16 or over 35, that we call advanced maternal age, you are at risk. If you had hypertension in a previous pregnancy, you're at risk. If you had preeclampsia in a previous pregnancy, you're at risk. If you're spacing between your 2 babies, between the last baby and this present baby is over 10 years, you are also at risk of pregnancy, of preeclampsia. And if you have a new partner, woman, you're at risk of preeclampsia.
Dr. Laura, you just said a mouthful. I mean, if I'm tracking correctly, we're saying pregnancies in the adolescent years, high risk.
Yes.
Advanced pregnancies after 35 years, also advanced risk. The timing between the birth of the babies, advanced risk. So many risks.
Right. And so the important thing is that you need to recognize if you're at risk. And this is not only for high blood pressure in pregnancy, but also for several other diseases and conditions. In fact, we have this maternal record book that the Ministry of Health offers to every woman who becomes pregnant, and it takes you 2 to 4 pregnancies. We also offer it to the private doctors. They can collect it from the health department. Right. And so every mother, whether you're in the private system or the public system, you should have a copy of this book. This book will document your investigation, and so it offers continuity of care. Every visit you make to the doctor is written here in this book. And so if you move from here to Westmoreland, the doctor in Westmoreland can continue to follow you up.
So we're following the patient history,
yes,
and mommy can track with the clinicians to know what's going on. What else, just giving a glimpse into these antenatal visits, what else takes place? You're talking about tracking the blood pressure, tracking the risk of the pregnancy.
Yes. So when they recognize that you're at high risk, you then be seen by specialist care. And with the specialist care, you refer to the high risk clinic where they see you every week and ensure you go to you. We ask mothers to ensure that they go to all the antenatal dates that are given to them, because we'll be able to identify when things are not going wrong, when things are going wrong and be able to intervene. For example, high blood pressure. You will feel normal. You won't even know that something is wrong. It creeps up silently. But as you go to your antenatal checkups and you recognize that it is, they will recognize that when things are going out of place,
Yes.
to be able to tell you. For example, we encourage mothers, if you see there's sudden swelling of your hands, face, and feet, know that something is wrong. Seek help. Speak up immediately. Do not wait and watch it. You know, we would normally say what is not broken, don't fix it.
Yes.
Hypertension is not that.
Yeah.
You don't need to have it broken at all. Because broken means life-threatening.
Yeah.
So that is very important.
Yes, and we have a culture here in Jamaica. We say, let me watch it.
Yeah, no.
Let me see what will happen. But we're saying something as important as your blood pressure, hypertension, the silent killer, can really have adverse effects on the pregnancy. We have been talking about some of the conditions that were observed. You mentioned your study, over 700 participants across the hospitals in the Southeast Regional Health Authority.
Which has actually 47% of Jamaican population and 45% of births occur in the Southeast region.
So this was a good crop
Yes.
to have done this study on. What I want to talk about, Dr. Lord, is some of the lifestyle changes that could support mothers on this journey. What can we do to lower the risks, as you have been talking about, for conditions such as preeclampsia and eclampsia?
All right. Thank you. That's a very important question because prevention is better than cure. Huh?
Yes.
And so we say to mothers, we say, one, ensure you exercise. Exercise. You find out from your health professional, say, can I do exercise? And you exercise. We have physical activity and pregnancy guide on the Ministry of Health website that shows you some very gentle exercise. Do some walking, eat healthy,
Yes.
eat lots of fruits and vegetables. You understand? Have a low salt diet. Stop smoking and using alcohol. These things just increase your risk and the severity of high blood pressure in pregnancy. And so these are some just simple steps that the population can do and women in the population can do to ensure they go into pregnancy with a healthy body. We ask you to stay hydrated, drink a lot of water, plenty of water, not juice, water.
Yes.
Juice will make you put on a lot of weight.
And so, Doc, some of the lifestyle changes that you have mentioned, we may think that these are simple because we've been hearing those very often. We hear that we should exercise, incorporate physical activity, get moving, and we hear about proper nutrition. But these are, again, very foundational to good health. As we're wrapping up, I want to find out...
Just before,
yes.
I want to say that we have to remember that having a safe pregnancy process is not the mother only. It includes the 3 F's, I will call it. It includes the father, the family, and the friends. It includes a community. And once they encourage the mother, she can end up have a healthy outcome for herself and her baby.
Right. So even family and friends and father supporting with those lifestyle changes. I love it. I wonder, Doc, were there any surprise findings as you carried out this study?
Yes. This study with the co-authors were Professor Afet McCorbins, Michelle Harris, Dr. Yo Alfred, Dr. Andrew Grant. Man, the thing is that we do not expect these mothers to die, but we found that mothers died with this process of preeclampsia and eclampsia, and this is a preventable death. That's one. 2, the babies, when they're born so small, when they're born too soon, and they're born very small, they need intensive care. And so sometimes, even though we have them, they deliver, is that they require intensive treatment within the nursery, including oxygen, fluids, the diet and everything changes. Oh. And so that was very important, and we found that We had to move from the mother's medical record to the baby's medical record to see what happened there. We would like to know what happened thereafter, but this study did not permit us to go beyond hospital care.
And so this...
But what happened is that most of the babies died before they born. Because the treatment for eclampsia, for example, part of the treatment protocol for eclampsia is delivery. So that is why they have to deliver the baby so that mommy's life can be saved.
Yes.
And that was very important. So we found that many persons who had eclampsia had very small babies requiring more nursery admissions, and so had a very critical course and a very traumatic course.
Yeah.
Thereafter.
And I can see the ripple effect that can have on the public health system, on our hospitals, on resources, and so on. As we're wrapping up, Doc, I just want to hear from you that final message that you'd give to our moms. I can see the passion on your expression. I can hear it in your voice as well. I'm giving you that final opportunity to talk to our viewers, our women, about the importance of antenatal care.
Yes. Actually, I say to women, pregnancy is not a disease. You need not die. Just ensure you seek antenatal care early, follow all your checkups, and when you see the warning signs, seek help. Seek help, not from nanny or grandma. Go to the health center, go to the hospital for care, for better outcomes for you and your baby. And I say to all of the population, support our pregnant women. We need to have a safe Jamaica with safe motherhood and safe babies. Babies deserve a good start in life.
A healthy start, an excellent start. I want to thank you, Dr. Carol Lord. She's award-winning public health specialist and program development officer in the Family Health Unit of the Ministry of Health and Wellness, awarded at the 15th National Health Research Conference. And her groundbreaking work is taking flight in the public health system and how we treat with antenatal care and our pregnant mothers. I want to thank you, Dr. Lord, for being with us. Thank you so much for staying with us here on The Wellness Beat.